hope I don't lower the tone with talking about evaluation findings. But we have been during an evaluation process, and I think this is a learning event, so it's relevant. And some of you last year were part of this process. We had some focus groups, so I thought it was quite important to feed something back to you. And also, of course, when we do an evaluation, it's going to inform what we do ourselves in the ESTHER program, what we do with you as partnerships. So, I mean, from the very beginning of the ESTHER Alliance, Ireland joined the ESTHER Alliance in 2013, and it's always been a question for us is about how are partnerships effective? How are they effective? What makes them effective? And what's the evidence for it? And over the years, through the ESTHER Alliance, we've done a number of evaluations. And this work, more recently, focuses on our own work in Ireland. Thank you. So the evaluation that we're talking about, it follows one we'd had a previous one that was done in 2021, which was assessing the effectiveness of ESTHER Ireland. So that was all that we do in ESTHER Ireland, not just giving grants, but all the different activities. And overall it came out with some positive findings. It was mainly consulting with people like yourselves, among the people from the partnerships. And so among the findings were that ESTHER Ireland was fundamental to the success of partnerships, and this was attributed to many different activities, not just to grants. It identified clear value for money and highlighting the need for greater resources. But it did also highlight that there was insufficient data with regard to evidence of impact and effectiveness. And that certainly caused to reflect, because that's always been a question, how do you show the evidence that these partnerships work? We're very convinced about it, and we've lots of data around quality of partnerships. So what about impact and effectiveness? And over the years with the ESTHER Alliance, and we've led a lot of this work, we've looked at different levels of evaluation. So obviously, in a partnership, you're doing activities and projects, and they're evaluated like any project using typical project management and modeling evaluation tools. And then also we look at evaluation for partnership, and we have a standard for that, and that's the ESTHER Charter for Quality of Partnership. And so we use that as a way of assessing quality of partnership. And then we're also interested in evaluating the impact of the whole partnership approach. What's the added value of doing the work through a partnership? So if you're doing an HIV project, you can do it another way. What's the particular benefit? What's the lasting benefit of the partnership approach? And we worked to develop an assessment tool for that, which many of you are familiar with, called the Effect tool. And most of what we focus on in the ESTHER program is the bottom two. It's the quality of the partnership and the partnership approach. And that's really quite deliberate, because we've not seen it as our role to monitor what the partnerships do. We obviously need to monitor for giving grants, the grant process, but that's your role in the partnerships. You will want to monitor and evaluate your own work, and that's your responsibility. And we're also conscious of not putting added burdens on partnerships. And I don't know, was one of you in this room maybe responsible for this quote, but the grants process being excessively cumbersome. And we've certainly come in for criticism over the years of being, let's say, very rigorous in our assessment of grants. And I think maybe for the size of the grants, maybe asking a little bit too much of people. And so to be asking for more, to get more information on what you're doing and the results, where we've been uneasy about really putting more demand. So that's sort of there as well. And our intentional focus has been on the quality of partnership, because the evidence is there that high quality partnerships are successful, that they're effective, that they deliver results. And we've been part of building the evidence for that. And that's built into our processes, into the small grants process, into the Effect tool, into the accreditation of partnerships. And then, but reflecting on this gap in information that we'd like to have, we realized, well, we actually have a huge amount of documentation about the partnerships through the grants program. Every application, everybody who gets a grant has to write a report. That's a big body of data. So we did then a further evaluation, a further stage of the evaluation, which was to analyze the effectiveness of the grants awarded using mainly that data and some additional data as well. So we want to assess the achievements resulting from the ESTHER grants. That's the particular focus, so it's not looking at everything. And notably, it's also not looking at some of the partnerships that are not supported by ESTHER grants. So for instance, the large HSE partnerships with different countries in Africa. That wasn't part of this review. And this was looking over the period 2014 to 2021, 50 grants, and it was over 400,000 of grants. But we had the same consultant, Andrew Jones, to this work as a previous one, and Andrew was a very good person to do this because he managed the grants program for PET in the UK, which was funded by the UK government, their £30 million funded program. So I just say 30 million just by way of a small kind of contrast with our own resources. And so that study was kind of in a number of different phases, and we were fortunate also to have the assistance of some students from the University of Limerick just to work with us for a couple of months. We were able to do some of the analysis. So it was a lot of work, a lot of qualitative analysis. And again, it came up exactly as the last time, that still that a lot of the results were, there was mainly narrative, that there was not a lot of quantitative data, and it was quite hard to really come out with strong evidence of the impact of the grants because of that, and that the documents tended to be limited to listing the activities. So I'll just talk briefly about a few of the findings. And these were similar to the previous part of the evaluation. They did highlight about the effectiveness of the partnership model. So we didn't feel we have to kind of prove that. There's a lot of evidence being built up that the health partnership model is a very successful approach to development cooperation, and that it can be more effective than a lot of traditional development approaches like technical assistance. And among the findings were that the achievements were really quite significant, particularly given the small amounts of funding involved. There was a rich diversity of activities within the partnership projects funded through ESTHER that have had impact at a local, district and national level, so many different levels. And the report acknowledges that some individual grants achieved a disproportionately large impact considering the grant size, and others reported numerous achievements. So really very positive findings about what was achieved, and saw others expanding their activities well beyond initial ambitions. The report also highlighted that the ESTHER funding was quite significant and sometimes been the catalyst or the means for some of these partnerships to develop, and without which they might not have got to where they got. They often had other sources of funding, and sometimes very significant funding, but that the ESTHER program played a role in helping them start up, and also in leveraging additional funding. So the grants received through ESTHER Ireland have been said by some anyway, the most important contribution to the establishment and continuation of partnerships and their activities. Support given by ESTHER Ireland staff and the effect tool were also highlighted positively. Findings point to positive results associated with characteristics of quality partnerships. The most commonly mentioned success factor was the establishment of good relationships. So we've talked about some of that today. Other factors include regular, clear communication, shared values, understanding of cultural setting of each partner, institutional commitment. I think you won't be surprised at those findings. And then looking at the strengthening of the Irish Health Service, we were quite keen also to see what could we gather information on how the partnerships were impacting on services in Ireland. What was the reciprocal benefit from the benefit back in Ireland? And the report highlighted that the majority of partnerships have not focused on this to date. So that's an area for us to reflect on and to think about what we might do in response to that. I think we've heard from some of the partnerships today, some of the benefits back in Ireland, but typically the partnerships start with the focus being on the need in the partner country rather than the needs here. And we haven't maybe been as intentional as bringing that into the partnerships and seeing how to optimize it. And then of those that have done focused on this, on the benefits in the Irish system, the benefits include involvement of local community, learning around better utilisation of limited resources, interdisciplinary approach, breaking down of hierarchical barriers in clinical settings, and gaining valuable clinical experience. And I think most people will talk about these things when you ask them how they benefit from the partnership. So I think in response to this, one of the immediate things we wanted to address was this issue of data, and could we improve through this process without adding burden to applicants for grants, on improving the data that would help us better understand the effectiveness and impact of the partnerships. And so we reviewed this year, and then this was then reflected in the new grant round, and some of you will have seen this who were part of it, that we tried to build this into the new process. We actually shortened the application form, so not to make it more onerous, but we did introduce some more specific questions on benefits to the Irish health system, and stronger emphasis on monitoring and evaluation at the different stages, including clear expressions of goal, outcomes and outputs with smart indicators. Now, we'd be hoping that that's a benefit, not just to ourselves because we get data, but also people to applying, to really do good planning, good project planning, because part of good project planning is to look at these things. And sometimes at the beginning is to collect good data around the baseline, because that will then allow you to measure results later. So having introduced this now at the latest round of grants, we'd be very interested to just get feedback and see how that has worked. So the other, I don't come too many other things, but just to touch on the area of funding, and it does come up in the different reports about the need for additional funding, or the value if there is additional funding, what can be achieved. And in the first report, one of the interesting things that came up was that not everybody was unhappy with the small amounts of funding. And it did strike me that there is a positive thing in not having a lot of funding, and funding came up as one of the big issues in partnerships and in hard alliance and so on. But when we in HSE go into a country initiating a partnership, we're very clear when we go in and talk and have discussions with our partners that we don't have money. We say, we're here, we're very happy to have technical cooperation and share technical knowledge and so on, but we're not a donor, we don't have money. And that can actually be very, very useful in the discussions at the beginning when we're not seen as a donor, a traditional donor, and discussions are all around what's the money going to be for. And you find that people often then, it connects with the right people, the people who really want to make a change, a positive change in the health service or in health, without kind of just being to do with money. So, and that really is the idea of these small grants. It's not about what you do with the project you do, it's more about getting the partnership established. And they are very small grants. And there is a positive in that, and I've been part of a lot of the other European ESTHER programs, and I was on the steering group for ESTHER Switzerland, and I've seen a lot of their applications, and they're for much bigger size of money, 100,000, 200,000, more sometimes. And it's about the project often more than the partnership. Of course, what they do is they have a project, and then they set up a partnership to do the project. But it's all about the project. Whereas I think that because we have done with that money, we don't fall into that trap or go down that road to the same way, because it is all about the partnership. And we're very convinced that if you get the partnership right, the rest will follow. But one thing we've seen is partnerships go on over a few years. They might start small, but then there's the opportunity to do something more ambitious. And I think the Gori Malawi Health Partnership is a good example. I mean, they've done a lot of things, starting small and building up. But they've got some ambitious ideas around training that could have very big impact in the country. Training in general practice and clinical officers and so on, and pharmacists. I mean, this could be very big impact. But you won't do that on a 10,000 ESTHER grant. And so, while we can do a lot with small grants, we are keen to see if there are opportunities to get more funding for significant work within partnerships. And we're trying that out. And one of the things we did this year is we introduced a new Band 3 grants, we call them, which is through the HSE Global Health Programme, which is allowing us to target some particular partnerships that are in the countries where we're working, so in a sense it can be part of our programme, where we can give them some additional funding for very significant projects, and particularly those where it's to do with strengthening health systems, maybe strengthening our key national health institutions. So one example is in Tanzania, is the Tanzania Blood Transfusion Service. Very key national service is now in partnership with the Irish Blood Transfusion Service. Another example, which I can't think right now. Pardon?
The obstetric training.
Yeah, that's the obstetrics, very similar to a bit along the lines of the very successful RCSI COSEXA partnership. Now the Institute of Obstetrics in the Royal College of Physicians is seeking to develop collaboration with the ESTHER and Southern African College for Obstetrics and Gynecology. Potentially very significant, and that will require more resources. but it gives that opportunity to channel more resources into key initiatives. So we're very interested in that. So I'm very interested to engage you around ideas of, if we get more funding, how best to use it. And as we take forward the results from the evaluation, that will feed into how we plan for the future. We'll be thinking of how we might continue. I think we want to continue to catalyse new partnerships. When I was in Ethiopia recently, I see a couple of new partnerships starting up. It's good to have supports for those. But are there then ways to put more significant funding into some of the very important partnerships that some of you are involved in? So, yeah, so that's on funding. And then in terms of the Irish Health Services, I think this is really important for us to really be, in a very deliberate way, look at how we can look at the mutual benefits and start bringing more of the benefits back in. And our CEO, who was at the signing, who signed the agreement, HSE agreement with Royal College of Physicians for the Equals initiative, recently commented on how much we can learn from Zambia. And I think it's true that it's not just what we learn because we're involved and bring back, that's one part of the learning. But if we could more institutionally capture learning and bring it in a more deliberate way into our health service. I don't know how to do that. We bring people over and get people to talk to our senior staff. Are they open to it? Somebody said it would require a change of mindset on our side to be very open to that. But I think there's opportunities there. I think there's an enormous amount of that we can learn in Ireland from the partners we work with. And we're very keen to see how to do that. So yeah, so we'll be using this report to inform the next stage of our planning, and we're very interested to engage with you on that. And we will be having Andrew Jones, who conducts the evaluation, over to meet with us and to help us with our planning. You'll no doubt hear from us about how things are going. But we're very keen to grow the partnership program, and I think we're very convinced of the success of it, I think, from all we're seeing, and hopefully we'll be able to do that. So that's all about that. I might pause there and see if any of you want to ask any questions or make any comments on that.